Upper trapezius. Origin: occipital bone, nuchal ligament on upper cervical spinous process. Insertion: outer third of clavicle, acromion process. Action: scapular elevation and upward rotation. Innervation: spinal accessory, cranial nerve 11, C3 and C4 sensory component. Middle trapezius. Origin: spinous process of C7 to T3. Insertion: scapular spine. Action: scapular retraction. Innervation: spinal accessory, cranial nerve 11, C3 and C4 sensory component. Lower trapezius. Origin: spinous processes of middle and lower thoracic vertebra. Insertion: base of the scapular spine. Action: scapular depression and upward rotation. Innervation: spinal accessory, cranial nerve 11, C3 and C4 sensory component. Levator scapula. Origin: transverse process of the first 4 cervical vertebrae. Insertion: vertebral border of the scapula between the superior angle and spine. Action: scapular elevation and downward rotation. Innervation: 3rd and 4th cervical nerves and dorsal scapular nerve. Rhomboids. Origin: spinous processes of C7 to T5. Insertion: vertebral border of the scapula between the spine and the inferior angle. Action: scapular retraction, elevation, and downward rotation. Innervation: dorsal scapular nerve. Serratus anterior. Origin: lateral surface of the upper 8 ribs. Insertion: vertebral border of the scapula, anterior surface. Action: scapular protraction and upward rotation. Innervation: long thoracic nerve. Pectoralis minor. Origin: anterior surface, 3rd through 5th ribs. Insertion: coracoid process of the scapula. Action: scapular depression, protraction, downward rotation, and tilt. Innervation: medial pectoral nerve. Anterior deltoid. Origin: lateral third of the clavicle. Insertion: deltoid tuberosity. Action: shoulder abduction, flexion, medial rotation, and horizontal adduction. Innervation: axillary nerve. Middle deltoid. Origin: acromion process. Insertion: deltoid tuberosity. Action: shoulder abduction. Innervation: axillary nerve. Posterior deltoid. Origin: spine of the scapula. Insertion: deltoid tuberosity. Action: shoulder abduction, extension, hyperextension, lateral rotation, horizontal abduction. Innervation: axillary nerve. Pectoralis major. Origin: medial third of the clavicle, sternum, and costal cartilage of ribs 1 through 6. Insertion: lateral lip of the bicipital groove of humerus. Action: shoulder adduction, medial rotation, and horizontal adduction. Clavicular portion: 0 to 60 degrees glenohumeral flexion. Sternal portion: 180 to 100 degrees glenohumeral extension. Innervation: lateral and medial pectoral nerves. Latissimus dorsi. Origin: spinous processes of T7 through L5 via thoracolumbar fascia, posterior surface of sacrum, iliac crest, and lower 3 ribs. Insertion: medial floor of bicipital groove of humerus. Action: shoulder extension, adduction, medial rotation, hyperextension. Innervation: thoracodorsal nerve. Teres major. Origin: inferior axillary border of scapula near the inferior angle. Insertion: medial lip of bicipital groove on the anterior surface of the humerus. Action: shoulder extension, adduction, and medial rotation. Innervation: lower subscapular nerve. Supraspinatus. Origin, supraspinous fossa of the scapula. Insertion, greater tubercle of the humerus. Action, shoulder abduction. Innervation, suprascapular nerve. Infraspinatus, infraspinous fossa of the scapula. Origin, infraspinous fossa of the scapula. Insertion, greater tubercle of humerus. Action, shoulder lateral rotation, horizontal abduction. Innervation, suprascapular nerve. Teres minor. Origin, axillary border of scapula. Insertion, greater tubercle of humerus. Action, shoulder lateral rotation, horizontal abduction. Innervation, axillary nerve. Subscapularis. Origin, subscapular fossa of the scapula. Insertion, lesser tubercle of the humerus. Action, shoulder medial rotation. Innervation, upper and lower subscapular nerves. Coracobrachialis. Origin, coracoid process of the scapula. Insertion, medial surface of the humerus near the midpoint. Action, stabilizes the shoulder joint, glenohumeral flexor. Innervation, musculocutaneous nerve. Brachialis. Origin, distal half of anterior humerus. Insertion, ulnar tuberosity and coronoid process. Action, the elbow flexor. Innervation, musculocutaneous. Biceps brachii. Origin of the long head, supraglenoid tubercle of scapula. Origin of the short head, coracoid process of scapula. Insertion, radial tuberosity. Action, elbow flexion, radio-ulnar supination, and assists in GH flexion. Innervation, musculocutaneous nerve. Brachioradialis. Origin, lateral supracondylar ridge. Insertion, radial styloid process. Action, elbow flexion, and indirectly contributes to radio-ulnar pronation or supination to return the hand to neutral position. Innervation, radial nerve. Triceps, long head. Origin of the long head, infraglenoid tubercle of scapula. Insertion, olecranon process. Action, elbow extension, glenohumeral adduction and extension. Innervation, radial nerve. Triceps, medial head and lateral head. Origin, posterior humerus. Insertion, olecranon process. Action, elbow extension. Innervation, radial nerve. Anconius. Origin, lateral epicondyle of humerus. Insertion, lateral and inferior to olecranon process and annular ligament. Action, assists in elbow extension and prevents elbow joint capsule pinching during extension. Innervation, radial nerve. Pronator teres. Origin, medial epicondyle of humerus and coronoid process of ulna. Insertion, lateral radius. Action, forearm pronation, elbow flexion. Innervation, median nerve. Pronator quadratus. Origin, distal quarter of ulna. Insertion, distal quarter of radius. Action, radio-ulnar pronation. Innervation, median nerve. Supinator. Origin, lateral epicondyle of humerus and adjacent ulna. Insertion, anteroproximal radius. Action, radio-ulnar supination. Innervation, radial nerve. Flexor carpi ulnaris, FCU. Origin, medial epicondyle. Insertion, pisiform and base of fifth metacarpal. Action, wrist flexion and ulnar deviation. Innervation, ulnar nerve. Flexor carpi radialis, FCR. Origin, medial epicondyle. Insertion, base of second and third metacarpals. Action, wrist flexion and radial deviation. Innervation, median nerve. Palmaris longus. Origin, medial epicondyle. Insertion, palmar fascia. Action, wrist flexion. Innervation, median nerve. Extensor carpi radialis longus, ECRL. Origin, supracondylar ridge of humerus. Insertion, base of second metacarpal. Action, wrist extension and radial deviation. Innervation, radial nerve. Extensor carpi radialis brevis, ECRB. Origin, lateral epicondyle. Insertion, base of third metacarpal. Action, wrist extension. Innervation, radial nerve. Extensor carpi ulnaris, ECU. Origin, lateral epicondyle. Insertion, base of the fifth metacarpal. Action, wrist extension and ulnar deviation. Innervation, radial nerve. Flexor digitorum superficialis, FDS. Origin, common flexor tendon. Insertion, sides of middle phalanx of 4 digits, 2 through 5. Action, MCP and PIP flexion. Innervation, median nerve. Flexor digitorum profundus, FDP. Origin, proximal 3/4 of ulna. Insertion, distal phalanx of 4 digits, 2 through 5. Action, MCP, PIP, and DIP flexion. Innervation, median nerve for the lateral half, digits 2 and 3, and ulnar nerve, the medial half, digits 4 and 5. Flexor pollicis longus, FPL. Origin, anterior radius. Insertion, distal phalanx of thumb. Action, thumb CMC, MCP, and IP flexion. Innervation, median nerve. Adductor pollicis longus, APL. Origin, posterior radius, interosseous membrane, and middle ulna. Insertion, base of first metacarpal. Action, abducts thumb CMC. Innervation, radial nerve. Extensor pollicis brevis, EPB. Origin, posterior distal radius. Insertion, base of proximal phalanx of thumb. Action, thumb CMC and MCP extension. Innervation, radial nerve. Extensor pollicis longus, EPL. Origin, middle posterior ulna and interosseous membrane. Insertion, base of distal phalanx of thumb. Action, thumb CMC, MCP, and IP extension. Innervation, radial nerve. Extensor digitorum, ED. Origin, lateral epicondyle. Insertion, base of distal phalanx of digits 2 through 5. Action, digits 2 through 5, MCP, PIP, and DIP extension. Innervation, radial nerve. Extensor indicis, EI. Origin, distal ulna. Insertion, base of distal phalanx of second digit. Action, second digit MCP, PIP, and DIP extension. Innervation, radial nerve. Extensor digiti minimi. Origin, lateral epicondyle. Insertion, base of distal phalanx of fifth digit. Action, fifth digit MCP, PIP, and DIP extension. Innervation, radial nerve. Flexor pollicis brevis, FPB. Action, flexes the MCP and CMC joints of the thumb. Innervation, median nerve. Abductor pollicis brevis. Action, abducts the thumb. Innervation, median nerve. Opponens pollicis. Action. Opposes the thumb. Innervation. Median nerve. Adductor pollicis. Action. Adducts the thumb. Innervation. Ulnar nerve. Dorsal interossei. Action. Abducts fingers at MCP joint. Innervation. Ulnar nerve. Palmar interossei. Action. Adducts fingers at MCP joint. Innervation. Ulnar nerve. Lumbricals. Action. Flex the MCP joint while extending the PIP and DIP joints. Innervation of lumbricals 1 and 2 between the first and second metacarpal and second and third metacarpal are innervated by the median nerve. Lumbricals 3 and 4 between the third and fourth metacarpal and the fourth and fifth metacarpal are innervated by the ulnar nerve. Flexor digiti minimi, FDM. Action. Flexes MCP and CMC joints of the fifth finger. Innervation. Ulnar nerve. Abductor digiti minimi, ADM. Action. Abducts the MCP joint of the fifth finger. Innervation. Ulnar nerve. Opponens digiti minimi, ODM. Action. Opposes the fifth finger. Innervation. Ulnar nerve. Iliopsoas, consisting of the psoas major and iliacus. Origin of the psoas major, T12 through L5 vertebral bodies, transverse processes, and discs. Origin of the iliacus, the iliac fossa. Insertion, lesser trochanter. Action, hip flexion and lumbar extension. Lumbar extension occurs within the psoas major portion. Innervation. The iliacus is innervated by the femoral nerve, and psoas major is innervated by L2 to L3. Rectus femoris. Origin, AIIS, or anterior inferior iliac spine. Insertion, tibial tuberosity. Action, hip flexion and knee extension. Innervation, femoral nerve. Sartorius. Action, ASIS, or anterior superior iliac spine. Insertion, pes anserine, or goosefoot. Action, hip flexion, external rotation, abduction, and knee flexion. Innervation, femoral. Pectineus. Origin, superior ramus of pubis. Insertion, pectineal line of femur. Action, hip flexion and adduction. Innervation, femoral. Adductor longus. Origin, pubis. Insertion, linea aspera. Action, hip adduction and hip flexion. Innervation, obturator nerve. Adductor brevis. Origin, pubis. Insertion, pectineal line and linea aspera. Action, hip adduction and hip flexion. Innervation, obturator nerve. Adductor magnus. Origin, ischium and pubis. Insertion, linea aspera and adductor tubercle. Action, hip adduction and hip flexion of the superior fibers, and hip extension with the inferior fibers. Innervation, obturator nerve and sciatic nerve. Gracilis. Origin, pubis. Insertion, pes anserine. Action, hip adduction and knee flexion. Innervation, obturator nerve. Gluteus maximus. Origin, posterior sacrum and ilium. Insertion, posterior femur distal to greater trochanter and iliotibial band. Action, hip extension, hyperextension, and external rotation. Innervation, inferior gluteal nerve. Piriformis. Origin, anterior sacrum. Insertion, greater trochanter. Action, hip external rotation and horizontal abduction. Innervation, nerve to piriformis. Semimembranosus. Origin, ischial tuberosity. Insertion, posterior surface of tibia medial condyle. Action, hip extension and knee flexion. Innervation, sciatic nerve. Semitendinosus. Origin, ischial tuberosity. Insertion, pes anserine. Action, hip extension and knee flexion. Innervation, sciatic nerve. Biceps femoris. Origin of the long head, ischial tuberosity. Origin of the short head, linea aspera. Insertion, fibular head. Action of the long head is hip extension and knee flexion. Action of the short head is knee flexion. Innervation of the long head is the sciatic nerve. Innervation of the short head is the common peroneal nerve. Gluteus medius. Origin, outer surface of ilium. Insertion, greater trochanter. Action, hip abduction and hip internal rotation and flexion using the anterior fibers, and hip external rotation and extension with the posterior fibers. Innervation, superior gluteal nerve. Gluteus minimus. Origin, lateral ilium. Insertion, greater trochanter. Action, hip abduction and internal rotation and flexion. Innervation, superior gluteal nerve. Tensor fascia lata. Origin, ASIS, or anterior superior iliac spine. Insertion, lateral condyle of tibia via iliotibial band. Action, hip flexion, abduction, and internal rotation. Innervation, superior gluteal nerve. Vastus lateralis. Origin, linea aspera. Insertion, tibial tuberosity via patellar tendon. Action, knee extension. Innervation, femoral nerve. Vastus medialis. Origin, linea aspera. Innervation, tibial tuberosity via patellar tendon. Action, knee extension. Innervation, femoral nerve. Vastus intermedialis. Origin, anterior femur. Insertion, tibial tuberosity via patellar tendon. Action, knee extension. Innervation, femoral nerve. Articularis genu. Origin, anterior distal femur. Insertion, proximal synovial membrane of knee. Action, draw synovial membrane superiorly during knee extension. Alternately, prevents capsular pinching. Innervation, femoral nerve. Popliteus. Origin, lateral condyle of femur. Insertion, posterior medial condyle of tibia. Action, initiates knee flexion by unlocking the screw-home mechanism. Innervation, tibial nerve. Gastrocnemius. Origin, the medial and lateral femoral condyles for the lateral and medial head. Insertion, posterior calcaneus via Achilles tendon. Action, knee flexion and talocrural plantar flexion. Innervation, tibial nerve. Soleus. Origin, posterior tibia and fibula. Insertion, posterior calcaneus via Achilles tendon. Action, talocrural plantar flexion. Innervation, tibial nerve. Plantaris. Origin, posterior lateral femoral condyle. Insertion, posterior calcaneus via Achilles tendon. Action, weak knee flexor and talocrural plantar flexor. Innervation, tibial nerve. Tibialis posterior. Origin, interosseous membrane and adjacent tibia and fibula. Insertion, navicular and most tarsals and metatarsals, 9 points total. Action, subtalar inversion and plantar flexion. Innervation, tibial nerve. Flexor hallucis longus. Origin, posterior fibula and interosseous membrane. Insertion, distal phalanx of great toe. Action, flexes great toe and assists in subtalar inversion and assists in talocrural plantar flexion. Innervation, tibial nerve. Flexor digitorum longus. Origin, posterior tibia. Insertion, distal phalanx of 4 toes. Action: flexes 4 toes and assists in subtalar inversion and assists in talocrural plantar flexion. Innervation: tibial nerve. Tibialis anterior. Origin: lateral tibia and interosseous membrane. Insertion: first cuneiform and first metatarsal. Action: subtalar inversion and talocrural dorsiflexion. Innervation: deep peroneal nerve. Extensor hallucis longus. Origin: fibula and interosseous membrane. Insertion: distal phalanx of great toe. Action: extends great toe and assists in subtalar inversion and assists in talocrural dorsiflexion. Innervation: deep peroneal nerve. Extensor digitorum longus. Origin: fibula and interosseous membrane and tibia. Insertion: distal phalanx of 4 toes. Action: extends 4 toes and assists in talocrural dorsiflexion. Innervation: deep peroneal nerve. Pectineus longus. Origin: lateral proximal fibula and interosseous membrane. Insertion: plantar surface of first cuneiform and metatarsal. Action: subtalar eversion and assists in talocrural plantar flexion. Innervation: superficial peroneal nerve. Piriformis brevis. Origin: lateral distal fibula. Insertion: base of 5th metatarsal. Action: subtalar eversion and assists in talocrural plantar flexion. Innervation: superficial peroneal nerve. Piriformis tertius. Origin: distal medial fibula. Insertion: base of 5th metatarsal. Action: assists in subtalar eversion and assists in talocrural dorsiflexion. Innervation: deep peroneal nerve.